Thank you. So, the members of the fourth estate, my fellow comrades and leaders, good afternoon.
Good afternoon.
My name is Peterson Washira. I am the National Chair for Kenya Union of Clinical Officers. Today, we are standing here in Nakuru PGH with quite unfortunate news. And today we are here to address Kenyans and to address clinical officers because the government has shown that it's actually tone deaf. If you don't shout to them, if you don't go on strike, they cannot hear what you are saying. And I'm saying this because Kenyans will remember that on 2nd of December, we came out as Kenya Union of Clinical Officers and gave a 21-day strike notice. When we were giving this notice, we actually informed the government and Kenyans that we were giving 21 days to allow for a conversation, for consultations, so that we actually did not have to go on strike. Further to that, because we know the government that we are dealing with and knowing the laxity in those offices, you also remember around 10th, actually on 9th of December, we went on demonstrations in Nairobi to remind them that there was a dispute they needed to address. Also, so that we can forestall this strike, because we as Kenya Union of Clinical Officers, we do not take any pleasure in strikes. In fact, our most comfortable place is in those hospitals attending to our patients. But even after that, and you remember CS Duale dismissing us, saying we were few, instead of addressing our issues, despite us demonstrating so that they can prioritize the issues in dispute and resolve them before the 21 days, they have failed to do that. And so that Kenyans understand sometimes the precarious situation we find ourselves in, the issue in dispute, one of them is collective bargaining agreement. The collective bargaining agreement is a subject to 2 sets of court orders. On August of 2023, Judge Bairam Ongaya of the Employment and Labor Relations Court directed that by December of 2023, we were supposed to have concluded our collective bargaining agreement. That did not happen. And that led to the strike that we went for last year for more than 100 days. And that was the longest strike in the history of clinical medicine in this country. The strike also ended with another court order midwifed by the court that had directed us through a consent to ensure that we have concluded the CBA by 1st of October 2024. We met with both Council of Governors and the Ministry. We negotiated, even agreed to extend that timeline to December 2024. After that, for the Council of Governors and the county governments, we tried doing correspondences so that we can come back to the table, resume the process, and ensure that we have concluded the CBA in line with what we had agreed and the direction of the court. But the Council of Governors that was tasked to ensure that that coordination is done to negotiate centrally did not answer even one of the many correspondences we did to them. On the side of the Ministry of Health, we continued very well, and around August, we concluded the negotiations on the CBA, and we got all the approvals from the Treasury and the SRC. But since September, when we were supposed to sign, the CS has not found time or has been adamant to sign. And you can imagine this situation, because it is good that Kenyans understand our situation. We have concluded the negotiation for a CBA, SRC has approved, because in other circumstances they usually cite SRC as not approved, and it's a constitutional body. In this case, the CBA we have with the Ministry of Health, all the approvals are there. It is only the CS who has refused to sign our CBA now for 3 months. So now you understand why we have no other option as clinical officers other than go on strike. The other issue is that there is a salary review that increased the salaries of all workers in this country in cycles, from cycle 1 to cycle 5. The national government where I work, we have enjoyed the increment for all the 5 cycles. But under the counties, they are still under the second cycle. Also in 2024, SRC advised the counties in this financial year of 2025-2026 to ensure that they implement the 3rd and 4th cycles. That is also not happening. And so we are saying the workers working under the county governments are not children of a lesser God. They must also enjoy what their counterparts at the national level are enjoying. So right now they are discriminated against ourselves who are working at the national level. And that has to be addressed. The other issue is about promotions in line with the career guidelines. And I'm happy to report that today the court has settled the issue of career guidelines, in that the same judge, Baira Mongaya, has just given a judgment some minutes ago, and he has declared that career guideline is a policy issue, and that the Public Service Commission was within its mandate to do the career guidelines for clinical officers, because this has been in contention with the Council of Governors. And we had agreed the promotions should have been concluded by the 1st of September of 2024. The issue of UHC, the Global Fund, the COVID-19 contracts is an issue that we saw being addressed under the summit, where the President and the governors met on 10th, and the resolution was that a framework be fast-tracked between the Public Service Commission, the Ministry of Health, the Council of Governors, to ensure that a smooth transition, an expedited transition, happens to ensure that the UHC and the COVID-19 and the Global Fund are converted into permanent and pensionable terms. But the unfortunate news we have today for Kenyans is that their government has refused to listen to reason. We have given them time, but they have taken us for granted. And so from Tuesday, 23rd, that is next week, all clinical officers working in public sector, whether under national government or the county governments, will not be at the workplace because the government has pushed us there. And I want to repeat that this is a strike that has been necessitated purely by the government officer, and specifically the county governments and the Ministry of Health, because of their laxity. And especially, I must say today, that we are really disappointed with the Ministry of Health, and especially with our CS Duale. And I remember when the CS came into the Ministry of Health, he said that he wanted to permanently address the human resource issues there. I want to pose a question to him. If you have a CBA that resolves human resource issues for clinical officers, and you are sitting on a document that only requires your signature without any explanation, is that being true to the principle that you articulated very well to Kenyans when you are coming to office? So this will not be a very merry festive season and Christmas for clinical officers and for many Kenyans who utilize the services of clinical officers, because the people that Kenyans elected into office, or they were appointed by those they elected, decided to neglect their duty, decided to bring other interests into a mandate that is supposed to be sacrosanct, and now as clinic officers, we do not have any other option other than to go on strike. Because as the law provides, when you have undergone conciliation, which we underwent in 2023 and failed, and then you go through arbitration through a court, you cannot go back to conciliation. So the only option that has been left for clinic officers now is to go on strike, and that shall be starting on 22nd of December, and that shall also be countrywide. Ourselves as Kenya Union of Clinic Officers, we have defined our bare minimum, and it's in our demands. One is that we must have the CBA signed and deposited in court by Tuesday next week. And that is a directive that was already given by court a long time ago. Number two, all the pending promotions and redesignations must be done and backdated to 1st of September as per the court order, which is pursuant to our agreement. Number three, the third and fourth cycles of salary increment by SRC must also be implemented before then. And lastly, all our staff on contract, their salaries must be harmonized at the SRC rate as we agreed in the Return to Work Agreement of 2024. On the US-Kenya health deal, let me say that as a union, as clinic officers, we support the US-Kenya health deal. We support it because we are health workers. We know how our patients are suffering, and especially where we have in the resource-limited settings, and especially for the programs that are being supported, the HIV, the TB, the malaria, and the others. You also know that US withdrew the NGOs that were working on this, which left around 28,000 health workers, a majority of whom are clinic officers, unemployed. So we support it because, number one, it's going to give our members livelihood. Number two, it is going to ensure that our patients, and especially for TB, on TB and HIV medication, continue having seamless flow of the same drugs. And number three, because any resource that comes into Kenya to support health sector moves the country towards that realization of the universal health coverage. I know there are concerns regarding the data, which we have read, but the type of data that we have seen, the aggregated data on conditions, is the same data that that we still send to WHO. Because we still aggregate data on different issues, including maternal health and the others, and we send it to WHO. So for us, those who have interacted with this before, we do not see anything different. But on the other hand, it's the right of Kenyans to adjudicate matters and ensure that something is safe. What I would request is that even as we do this, let us not bring that arrangement to a halt. We allow our patients to enjoy the services of the workers and to enjoy their medication, because at long last, even as we fight in courts and elsewhere, if this is going to be stopped, there are many Kenyans who have TB and multi-drug resistant TB, as well as who are on HIV and other medication, who are going to suffer. So we should have a very amicable conversation around what needs to be looked into, what needs to be explained, so that we can get that clarity as Kenyans. But as clinic officers, we are fully behind that deal, and we are really waiting that our members can be absorbed back into employment. Thank you.
I'm Seprin Kerubo. I'm the branch chair, Nakuru County. And from the deliberations that we've been having with the Department of Health, I think it has reached a moment that clinical officers, we need to come together so that we can have that solidarity and unity, so that we can be able to give service delivery when we are really having that morale to serve our patients. So in our department, I think there are many issues that we've raised to the department, and we had a meeting, and I think the only way out is just to go on strike so that the Ministry of Health and the COG can come in together and give us our CBA, and also the third and fourth cycle of the SRC payments. I think the county needs to look on that. And as I conclude, let our citizens of Nakuru County come out, tell our governor, kindly talk to the COG members too, so that we can conclude this CBA that we signed long time ago. We've really negotiated it from since 2017 up to date. What are they waiting for? CS Duale, please come out, sign that document so that we can have a good working environment at our workplaces. Thank you.